All right, good afternoon, everybody. I'm Katrina Harris, CEO of Uproar PR. I'm excited today to have Dr. Anthony Orsini. He is the founder of the Orsini Way, and he is joining us today for this edition of Perfect. Welcome, Dr. Orsini.
Well, thank you for having me. I'm honored to be on.
Thank you. So obviously the work you do is very impactful in the healthcare community and now in the business community, but specifically for doctors, staff, and patients alike. Can you tell us a little bit more about the Orsini Way and how it came to be?
Well, the Orsini Way provides communication training to hospitals, patients, and even businesses on how to form relationships with patients, employees, et cetera, and how to do that in a compassionate and very deliberate manner. So we teach communication. As you know, I'm a practicing physician in Orlando. And about 20 years ago, I became fascinated with how physicians discuss both tragic news, but also interact with patients and families, and really looked at what was wrong with healthcare. And although we've made such great advancements in healthcare, the communication training seemed to be lacking. And we've all had physicians that we love, and we not maybe don't know why we love them, but it's probably because they're good communicators. And so I saw this big hole in healthcare, as if you will. And so 10 years ago, started a program called Breaking Bad News, which trained physicians, healthcare providers, and other healthcare professionals how to communicate tragic news with patients and families. And we started off using professional actors, and that was really so successful that we started moving towards better communication training in general. And so we've trained thousands and thousands of healthcare professionals how to form relationships, build rapport with their patients, improve patient satisfaction, which is a big topic right now. And now we're pivoting even more to helping business leaders, helping managers become leaders, helping human resource people have those difficult conversations with their employees. And so I've always been fascinated with communication, how not only doctors communicate, but how people do that. And so really this is, the Orsini Way has really come a long way since 10 years ago when we first started.
You're a busy man, published author, running a podcast, physician, the Orsini Way. Do you sleep?
I don't know how I fit it all in, but yes, I'm a full-time physician. And yes, we started the podcast August 4th, Difficult Conversations, Lessons I Learned as an ICU Physician. And that podcast went to top 200 right away. Recently published a book called It's All in the Delivery. But I think the reason that it seems like I'm doing so much is that I love it. I'm fascinated with it. I don't feel like I'm working when I'm writing the books or doing the podcast. To me, it's a hobby, but it's also my business. And so they say, if you love what you're doing, you'll never work a day in your life. And I think that applies for me here.
So we've been working together for, I think, just over a year or so. Can you tell me what led you to implement a PR campaign?
Over and over again, we were being told, you're a better product, you're much cheaper, but you're riskier because you're small, you're new. And it's just, one person told me, who was head of patient experience, he said, if I go to my CEO and tell him that I hired you and you don't work out, it's much more risky than if I hire the big 3,000-pound gorilla and they don't do well. So as much as I know in my heart the Orsini Way is better, I just can't take the risk. And so that's when I decided I need branding. I need people to say that the Orsini Way is not a risk. And on my part, we're doing project over project, and we're showing data, we're showing good numbers. But if no one knows about that, I think we're going to continuously be considered a risk. And that's why I went ahead and hired a PR department.
And I know we do a lot in terms of media relations for you, but can you talk a bit about what we do beyond receiving media coverage?
Well, media coverage, you've helped me with my social media networking, help get the word out. We're pivoting right now to a lot of remote learning with the COVID crisis. So we're putting out some new products. Uproar has really helped me with my branding. They've been really great we changed our website, so they've had some input and some really helpful hints on what that looks like. And the Orsini Way is really branding two things. We're branding the company, but we're also branding me because I'm the face of the company. And so I think Uproar's done a real good job helping me do both of that.
Any closing thoughts? I know you mentioned that you had worked with PR partners in the past. What do you think makes, you're obviously in the communications industry yourself. What do you think makes a good PR partner?
It's been said multiple times that entrepreneurs learn through their mistakes and not through their successes. And I've certainly done that. I'm a physician. I've had to learn through mistakes. And so we actually had another PR firm before that. I thought, who knows? Like I had no idea how to pick a PR firm, and they were okay. But the reason why we pivoted over to Uproar is that things with that PR firm just seemed to take forever. I'd have a meeting with them. We'd say, we'd like to do this. And it goes weeks and weeks and months and nothing happens. And we're paying them a monthly fee like we do with Uproar. So, but with Uproar, the difference is I have my team, I meet with you guys once a week. We come up with an agenda and then it just gets done. And that's what I love about Uproar and Dan and Courtney and Laurel and everyone that I'm working with there is that they're following up with me. And I'm so busy, as you said in the beginning, that sometimes I forget to follow up. That, Uproar will say, here's what you have to do this week. Here's what we decide I have to do. And I'll get a nice gentle reminder saying, Dr. Orsini, we're still waiting for that. So I need that because I'm so busy. And I think that's been the big difference with Uproar is that we come up with a plan, we decide to do it, and then it just gets done, as opposed to me emailing someone else several times going, when is this going to happen? When is this going to happen? Mostly it's Uproar going, Dr. Orsini, we got to make this happen. And so I think that's been the big difference.
Well, we are honored to work with you. Again, I really appreciate your time.
All right. Thank you. It's great having, thanks for having me. Appreciate it.